how to protect your kidneys. This is a really important topic, especially in people with diabetes. This is because 20 to 40% of diabetics have chronic kidney disease or will develop chronic kidney disease in their lifetime. So this is something that we're always looking at. That's what we're going to talk about. What can you do to protect your kidneys? A lot of times in practice, once you mention kidneys, like patients get really scared and upset. Just because you have kidney disease doesn't mean that you're in kidney failure. Okay, a lot of times people get those two things confused. Kidney disease is something that's just ongoing for a long time, and a lot of times it's associated with a disease process. And a lot of times the way to manage that kidney disease is to manage the disease process. All right, and if you're doing that, then that's pretty much all that you need to do. So how do you protect your kidneys if you have diabetes? This is either type 1 or type 2. So the main thing that you need to do is to keep blood sugar under good control. What does that actually mean, good control for blood sugar? So if you do have diabetes, before meals, your blood sugar should be less than 140. That's generally acceptable. And after meals, your blood sugar should be less than 180. And that would mean that you're pretty well controlled. And if you're in that target range, when you do your A1C level, you're somewhere in the 7 or less range. Now, that brings me to the next thing that shows that you're having good blood sugar control is an A1C of less than 7. And there were studies that were done like several years ago, like in the early 90s, where it was shown that having an A1C less than 7 helps to prevent the progression not only of kidney disease, but other complications associated with diabetes. That's where we got that number from. We didn't just pull it out of nowhere. It's based on evidence. The problem with not having good blood sugar control is that when you have high blood sugar circulating around for a long time, it can affect the tiny blood vessels in the kidneys. And these are very, very small blood vessels. And over time, that leads to damage. They're not able to filter out waste products as well. The waste products start to build up in the body and start to cause problems. And eventually, if that's not controlled, then that can lead to kidney failure in the long run because the kidneys have gotten so damaged. So the main thing is to control blood sugars. And if you're doing that, then we're monitoring it and making sure that things are okay. So that's number one is good diabetes control. Number two is making sure your blood pressure is in normal range. What is the definition of normal range? It varies depending on the individual. So in adults without any medical problems, normal blood pressure is considered less than 120 over 80. It's not less than the 140 over 90 anymore. That was like 40 years ago. Less than 120 over 80 has been shown to be normal blood pressure, and blood pressures higher than that are associated with problems in the long term if they go on for a long time. So less than 120 over 80. If you're normal adult, no medical problems. Now, what if you do have high blood pressure or you have diabetes? This is either type 1 or type 2. Then your blood pressure goal is less than 130 over 80. If you can get it less than that, then that is associated with a decreased risk for long-term complications associated with chronic kidney disease and other complications too, like heart disease and stroke. But for the purposes of this talk, we're focusing on the kidneys. So having a blood pressure less than 130 over 80 helps to protect your kidneys. But if you can't do this just by lifestyle alone, some people are able to control diabetes with lifestyle. Those are people who have reversed diabetes. It's not a cure, but you've reversed your diabetes, so you're able to control it with lifestyle, which is great. Blood pressure, too, if you're able to control it with lifestyle, that's also good. But if you can't, then that leads to the third thing that you need to do to protect your kidneys, which is to take your medications as directed, because those are helping to protect your kidneys too. For example, in diabetes, if you're on medication like metformin, the metformin is helping to control your blood sugars, which by lowering your blood sugars, that's preventing kidney disease. Okay, it doesn't directly just, metformin is preventing kidney disease on its own. It's doing so by lowering your blood sugars. However, there are some diabetes medications now that help with diabetes, and they're also helping to directly prevent the progression of kidney disease if you already have it, or it's protecting your kidneys. And these are the SGLT2 inhibitors. These are things like Farxiga and Jardiance. These are medications that on their own, whether or not you have diabetes, are going to help protect your kidneys. And so some people who don't have diabetes are on the SGLT2 inhibitors just to protect their kidneys. Then if you have high blood pressure, you're on blood pressure medications to control your blood pressure. And by controlling your blood pressure, that is also helping to protect your kidneys. There are some blood pressure medications that on their own, in addition to just controlling blood pressure on their own, they're protecting your kidneys too. So they have two functions. For example, something like lisinopril. If you're on a dose of 10 milligrams or higher, that's actually the blood pressure dosing, which also includes kidney protection. But if you're on a dose that's less than 10 milligrams, and typically it's like 2.5 milligrams or 5 milligrams, those are generally kidney protection doses. So just taking your medications as directed is going to help you protect your kidneys and to prevent the progression of chronic kidney disease if you already have it. And as your doctor is doing your blood work, they're checking your urine. They are looking for signs of kidney disease or making sure that your kidney disease is staying stable. This is why it's important to make sure that you're staying on top of your regular medical checkups, getting all your blood work done, because we're looking at these things. And lastly, I want to say avoiding toxins is important too, unnecessary toxins. These put extra strain on your kidneys that are already working to just get rid of the day-to-day toxins that are in our environment. What is an example of an unnecessary toxin? Smoking. Smoking is something that can lead to chronic kidney disease because you're getting in all the extra chemicals that are not good for the body. And those have to be processed too and excreted out. And the kidney is doing that job. It's doing extra work. And over time, smoking for a long time also can lead to chronic kidney disease. And by the way, chronic kidney disease is also a risk factor for heart disease. So everything is really connected. The main thing is just to make sure that whatever medical condition that you have that puts you at risk for kidney disease, things like diabetes and hypertension, make sure you have those medical conditions under good control. All right, I hope you got some value from this tonight. If you did, please make sure to like this video and share it with somebody else who might be able to get some value. This is how we get the word out. For other tips like this and even more things to help you with managing your blood sugar, managing your health in general, be sure to get my free ebook, which is at the website diabetesresource.org. And if you go to the website, you will see other resources too.